Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com, you will find the show notes, 11 free tips as a PDF, and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Welcome to episode number 15, Living with MS in Belgium, where I interview patient advocate Pieter van Galen. Pieter is a patient advocate at the European Multiple Sclerosis Platform, shortly EMSP, a trainer and consultant from Advocacy in Belgium. Hello, Pieter. It's lovely to have you today on the show, and a warm welcome to Advocacy in Belgium.
Thank you very much. Yeah, no, it's great being here today. The weather's not wonderful, but I'm indoors, so it's all fine. Yeah.
That's good. And before we start with the interview, it would be lovely if you could introduce yourself a little bit to the listeners.
Yeah, sure thing. So my name is Pieter, as you just said. I'm a patient advocate for MS. Have been so for, about 12 years or something, or maybe longer, 2008. I'll give you a short synopsis about my MS journey. I was diagnosed in 2017, earlier, 2007, I think even, because my very first attack with MS, I can relate back to when I was 9 years old. So became, a long time ago. It took quite a long time actually for it to be diagnosed. That was in 2007 when I was 31 years old. I've had many things over the years, and usually during holidays. So then I was acting too busy, and I couldn't write anymore with my left hand, or my leg wouldn't work anymore. And the doctors always said, it's just stress. You've been too busy. It'll go away again. And it always went away until finally in 2007, we said, well, it's getting a bit annoying now. Mm-hmm. And we went into a hospital. I was on holiday that time with my wife. We just got married. And he said, I don't really know for sure, but since you've told me all these things, it could well be MS. So then I had to first go back to a hospital close to where I lived, and they made the final diagnosis. So that's been a while now. About me and myself, I've been happily married since 2005. We have two daughters. One, Emma, she is 13 years old, and Sophia is 11 years old now. So I've got a house full of ladies.
Very good.
Very good. Of course, MS has an impact on my life. But since 2008, when I moved to Overijse, we got talking to a neighbor of mine. And he told me at a Christmas party, I'm the director of the European MS Platform, which is an umbrella organization dealing with all European MS societies. I said, that's pretty cool, because you're basically helping me out as a patient. And since then, I've been actively working with the EMSP on European and also global level. Since then, I've also been involved with various steering groups. And this is just one part of my daily life and work, actually, because besides that, I'm also a trainer consultant. So I do different types of trainings, software, communication training, public speaking, also audits. So I've got quite a busy life still, despite of MS. And actually it's an addition having MS, because I tend to speak to groups and try to convey what it's like living with a disease like MS. So that's a little bit about myself.
Thank you very much for that introduction. You are really a busy person, and it sounds like you have a very fulfilling life, which is great. Yeah,
I try to do so. It's actually been, it sounds strange maybe, but a blessing is not the right word, but it's giving me so many more options and things that I would never have done without having a diagnosis of MS, that it's just been, you try to make the best of it. Yeah.
That's good. That's good. And it's always lovely to have neighbors like you do. who have nice
amazing
connections.
Quite. Unfortunately, he moved now to the Philippines because his wife is from the Philippines, and he's retired now. We're still in contact, and he's a really good friend. So I've also been invited to go out there. But having to save some money still.
Yeah, Philippines is quite a bit away, and flying there. It depends on your daughters would be coming with you, so you have to buy four tickets, and that's expensive. I can see.
Okay,
In your experiences, what are some of the most effective coping strategies or self-care practices for managing the daily challenges of living with MS? I mean, you are living officially since 2007, so that's at least quite a while.
Yeah, right. Well, when I was diagnosed, I didn't know anything about MS. So my mom got me some brochures because she would collect money for MS, going around in Holland, taking or with a canister and ring doorbells, say, I'm going to get some money for MS. She gave me some brochures, and I was actually reading those with my wife when we were in the sauna. And I was reading things like, you'll get very depressed, you might have suicide attacks, you'll probably get divorced. And I'm like, all these things, it's not me. So I skipped over those pages. I said, no, that's not me. Positive mindset. I think that's number one. Mm-hmm. So think about the things that you can still do and all the things that you didn't even know they existed before having MS. So a couple of very practical things that I now see as a bonus. I was asked to get one of those parking cards, disability cards. And I didn't really want one, because I felt it's a pain having to do that and to show people that you have something. But now it's brilliant because I can park, in those spots that we see. Also, in many major towns, you don't have to pay for parking when having a card like this, which is great for people from Holland because they always like to save money.
Yes.
When I go to the airport, normally you've got these huge distances to go if you have to go to gate number 20 or 50 or 100. And I get assistance now at the airport, which is brilliant. You're racing through the airport with somebody pushing you in a wheelchair or in one of those cool electric vehicles. You also go to areas where you don't normally go. Sometimes I've been taken on the tarmac and getting in the back of the plane as a first person in with all the food. What else do? I attend international congresses, speak to so many people like you now. So it's basically my world has opened up more than it's actually reduced in size. Yeah. And I think that's what you should keep on looking at. Yeah.
Yeah, it's about perspective normally. Yeah. Absolutely. And you are a great example of how you can turn it into a positive thing.
Yeah.
You just mentioned it. I mean, mental health is quite important and emotional well-being. What support is available in this regard?
Well, in Belgium, first of all, I didn't really want to talk to any psychiatrists. But there's obviously specialized psychiatrists also in the MS field, not everywhere. So I now go to an MS center, and they have lots of different people there, from psychiatrists, dietists, nurses, whatever you can find, basically. So it's a very full-on help. Psychiatrists do help many people. Mindfulness training is another thing that I'm told is really a very positive thing for many people that are coping or having difficulty coping with the psychological effects. As you can hear me talk, I'm not really in need of these things, luckily. Yeah, I always touch wood. But it's great to know that they are there if necessary. I spoke to another psychiatrist, I think in December. I went in for 3 weeks to do some rehabilitation in the MS Center in Belgium. And one of the things was also to go and meet a psychiatrist. So I did, and I gave my story. He says, I don't really know what I can do for you because you sound very happy and very fulfilling and stuff. I said, no, that's perfectly fine. I'm happy you see it that way as well. But I obviously know there's lots of people that are suffering from, burnout or unhappy feelings and things. And it's really a big help to talk to a professional like a psychiatrist, but also to join, talking groups, either with peers, other people with MS, through the MS League, MS Society in Belgium. They have two of them because Belgium is officially 3-lingual country. Mm-hmm. There's the Flemish bit, the Dutch, the French bit, and also a small German part. There's 2 different MS societies in Flanders and in the French bit in Wallonia. And they also have talk groups where you can get in touch with other people, but also for their, let's say their husband, wife, or even their children they also have specific groups for talking to people there, which I think is a big help. I joined the group once, and again, it wasn't really for me. It was fun because I was there as the only male person, and there were 19 ladies, so I felt very cool there. But it didn't really do too much for me as a person, and not having too many psychiatric issues. But I definitely feel that it's important for people to do and search things that work for them. Yeah. So it's great that they have these options.
Absolutely. And everybody has to find for themselves what works for them. Talking about the treatment and care in Belgium, are there certain treatments, therapies or interventions that are more commonly or accessible in Belgium? Yeah,
when I was diagnosed, there was not as much around as there is now. I mean, now you've got a menu of all the things you can get, basically. And the neurologist gave me a big stack of papers saying, wait, this is what we have currently. I said, anything except needles. And she said, no, unfortunately, there's not possible at that time. So I started reading all the different things on DMTs, etc. And we sort of together came up with a treatment. Yeah, I've done that for many years. And then I said, I don't really feel that it's stopping the disease as I was hoping it would. And then the neurologist said, we have a trial going on currently for the next phase, like the secondary progressive, but we're not sure that you've really moved on to that one. So you could stop your current treatment, or you could try and opt for the trial, which I did back then. And so I was in a trial, not knowing if I got the real medication or the placebo. After that, I moved on to different medications. So there's lots out there now, and people have obviously the choice. What works for them. If you travel a lot and you need to travel with needles, it's not the best. Now I go twice a year into the MS center, and I get my therapy there. It's a bit of a pain to get the needle inside my veins, but when it's finally done, it can take up to half an hour. Then I'm happily there, and I'm working all afternoon or all day long. So there's lots out there. So I feel very blessed by being here. Because of all the options that are available. Yeah.
Sounds great. And I think as I will move on with interviewing people from different countries, I think there will be differences in that. I mean, I guess it's all paid by healthcare system like it is in Germany.
As good as everything. I mean, when I see how much I pay of going in for the full day with getting my treatment, I think at the end of the day, I pay 10 euros. I get 20 cents for certain pills that fight some side effects, and then my lunch. And that's it. But then I see the bill for the social
extra costs,
and I have to add a few zeros behind the 10 euros. Yeah. So it's really impressive. But as you will get into more other countries as well, within the EMSP we have something called the MS Barometer, which is planned on a yearly basis, and they go into different countries and they look at what's the accessibility for different medication, how much is paid back or not paid back, what other services are there. You're going to find a huge difference within Europe. And when I speak to people from the UK, it could even be within a country. Yeah, depending on what area you live in. And it's the same for Belgium. As I already said, there's the Flemish bit, and then there's the French area. And they have a lot less options for MS nurses, for instance, I found out. So it really depends where you live. And that's why I say I'm quite happy and blessed with the region I live currently. Yeah.
Yeah, I mean, at the end, of course, it's a little bit the same here in Germany. If you are with let's say, a normal neurologist who is not focusing on MS, he might not offer you all the options.
No, you might not know about all the options. I mean, it's not always their fault.
Yeah, of course.
Yeah. And again, very lucky for me that I live quite close to this MS center, which is the national center. In the beginning, I never really wanted to go there because you see people from all different areas with MS. And then I was happily running around still. And you see people in wheelchairs. So it's very in your face. Yeah. But you have to get over these things. And now it's more of a motivation to do exercise in order not to get into.
Same here.
You understand my point?
I totally understand your point, yes. Are there any specific laws or regulations in Belgium that protect the rights and promote the well-being of individuals living with MS?
Yeah, well, luckily, if you're employed, you don't have to tell your employer that you have a certain disease. So in that respect, they cannot really fire you on the basis of you having a disease. So that's one thing. Now, I'm self-employed, so I look in the mirror and I tell myself, "Are you okay?" Yeah, that's all fine. But that's definitely an important thing for many people, because they're frightened. What will they do if they tell their employer? Will they get fired? Will they be looked at differently, etc.? There's also assistance from the government to help the employers to adapt your working environment. Let's say a chair, or getting more breaks and things like this if people have issues with cognition or other things. So all these things, they are regulated. Also, when I was diagnosed, I already had a Social Security thing going. So then they cannot throw you out, since later on you have a certain disease. So that's something that I can say. What else do we have? Yeah, Social Security. Lots of medication is paid back, I said. I also got disability status. You can get, if you have all the criteria, if you meet all the criteria, so you have more money that you can get for people helping you at home, for instance. Allowances from the government if you really can't work anymore. So all those things, again, are set up and specifically aimed at people with certain diseases, not only MS. Yeah.
Of course, not only. Yeah. Sounds good. Yeah. And are there any recent advancements or developments in MS treatment, care or support in Belgium that you find particularly promising?
Promising. Well, the stem cell treatment has been out there for quite some time. And when I first heard of it, I thought, oh, that's brilliant. It's like a Control-Alt-Delete. You reset your immune system. Then I started talking to my neurologist about it, and he says, yeah, but it's only done in very specific cases when it's a very aggressive MS. Things now I understood are paid back, so it's not like you have to pay $40,000 or $50,000, $60,000 or euros out of your own pockets anymore. But I had a friend from Germany, actually, and he went to Moscow to do the treatment a couple of years ago. And yeah, it cost him, I don't know, I think about 50,000, not knowing if there would be a positive outcome or not. So these are things that obviously I try to follow up on. But at the moment, I've made a decision not to go for a treatment like this. Also because I'm not in the target group anymore. Age-wise, and not a very
duration of disease, I guess.
Yeah, all these things. But who knows in future? Yeah, that it will become more and more widely spread, and also for people with that medication. Now, when I was diagnosed in 2006 or 7, there wasn't a lot of things out there, as we said before. Now we've got a whole menu and a recipe full of possible medications. So it could either be needles that you put yourself, or you can go into the hospital 2 times a year, 12 times a year, whatever you want, even oral medication. So there's probably lots out there. And I think most of the things that I see at different congresses, they are quite quickly adopted also in Belgium.
That's great.
So that's again a big bonus for me. Yeah. So as a patient, you can choose yourself quite often. We see with help of the neurologist, I would say, don't just pick and choose anything. But depending on your lifestyle, depending on side effects and things, you can opt for many different medications. Now,
great. And it sounds like stem cell therapy is officially fine in Belgium, because it's not in Germany. It's still in study modus. So it's not so easy if you are in the target group to get it, actually.
Yeah, no. I'm very, again, pleased with hearing that it's all paid back. It's only for special cases.
Of course. Just a few ones.
Yeah, just a few. Yeah, lucky is not even the word. That's a good thing. So you can see the difference in a country where just neighbors, and and you have the same thing when going to France or to Holland, maybe, that there might be differences left and right. It just depends on what the government and the social security system pays back in the end.
Yeah, absolutely. Can you provide us maybe an overview of the healthcare system in Belgium and how it supports individuals living with MS? I mean, you more or less did already. Are there any additions to that?
Not too many. I think the Social Security is really, really good. So with MS and other diseases, a lot is paid back. There was something a couple of years ago, it wasn't MS based, but there was a baby, Pia, she was called, and a very rare disease. And there was only medication that was available at €1 million. They ended up doing, because the Social Security said we can't pay this for just that 1 or 2 cases that we have. And it would be $1 million every year. So there was, money being collected, to crowdfunding to help that baby actually. And then the government said, okay, this is really bad that we have to go to the public to raise money. We should actually put this in our Social Security system. So I think then they changed the Social Security to also have this very special disease being paid back even. Yeah. So they do follow up things. The government is trying to help as many people as possible. Now, of course, there's only so much money around. That's why we have a lot of taxes. But I still think that it's a very good thing to have all those opportunities or possibilities to get payback from Social Security. Yeah.
Great. And it sounds a bit like maybe due to lower population, you are a bit faster.
Maybe so. Yeah, maybe so. Yeah.
That's good.
If it's a big country and there's many people, then obviously the budgets are limited. Yeah.
Yeah, or let's say it takes a bit longer because so many people are having different opinions about things.
Yeah, that too. And then if too many people want to have a say, it takes a lot longer. Yeah.
What types of healthcare professionals are typically involved in the care and management of MS in Belgium, and what role do they play?
Yeah. Well, first of all, I think general practitioners are maybe your first person you go to when you have symptoms that you can't really explain very well. Now, I do think that my general practitioner also said, I'm the first person in his 20 or 30 years in practice as a person with MS. He says, my father was a general practitioner and he never had anybody in his entire career. So general practitioners could be a first, but then you're quite quickly, aimed to, neurologists, first of all, that go either into hospitals or other, areas where you can find them. Physiotherapists is a very important one as well, that are open for, people with MS. I go twice a week to a physiotherapist and, again, mostly paid back. I think I pay, hardly anything, a few euros perhaps per session. I think when you are in a good center, or a hospital that has a specialized MS neurologist, you might be lucky enough to have MS nurses as well there. But again, like you said, in Germany, it depends on the region you live in. Yeah. I'm again lucky to live very close to this MS center now. I also live close to a big university hospital where I was very well, supported. Yeah, by a neurologist that was very much into MS. That was her passion, let's say. And also they had one MS nurse. Yeah. The center I go to now, I don't know how many nurses they have. But there's a huge number of them, plus physiotherapists, plus this and that. So it's really a whole collection of, people that can help you with dietary issues, with even, finding allowances. So people that, can help you with, grants or other things that you can apply for. It's all out there. It's amazing.
Great. Sounds really like an all-around package. I mean, that's good.
The package. But again, it really depends on the area.
Yeah,
if I were to go to the west of the countries, 102 kilometers away, they might not have all these things on offer. Then you have to move yourself or, see what you can get.
Yeah. The bigger the city, probably the more the offers and the more the countryside.
That also helps. And it also depends on the neurologist that you work with, if it's a specialist, MS related or non. If it's a general neurologist, obviously you cannot expect them to know everything.
Of course. Yeah. Because they have to keep up with all the other neurology diseases.
There's so many neurological diseases out there. I mean, it's scary. I always think it's really not an easy thing as a neurologist to know who you have in front of you.
No, and I think it will split up in the future. I mean, they can't do everything all at once. I think it's not possible. You already mentioned the two patient associations who are existing in Belgium. What do they offer? I mean,
they offer. Well, I'm part of the Flemish Patient Association. What they offer is they started, I think, a year ago, maybe. They wanted to look for MS experts. So in their magazine, they have a magazine coming out every 2 months, I think, about all different things in MS. Research as well is discussed there. But they also look for MS experts. So then they went to their population of patients, and you could apply to become an MS patient, or an MS expert, excuse me. With that, we had to follow a training first of all, and then there was a big celebration at the end when you graduated. And so what they do now is when they have a request from either pharma or schools or universities or social security people, they can opt to take one of their experts and we talk to them, give them insights about what it's like to live with MS or, whatever the question may be. Yeah. So that's quite interesting that the MS Society offers. What else do they offer? They offer, open days. I once registered my two daughters to go on a weekend trip with the young people with MS. Well, not with MS, but the
relatives.
The relatives, there you go. Yeah, for young people, because it's quite difficult to explain a disease like MS to your children. What is it exactly? Yeah. And I don't think they still understand. I don't think they understand very well at all. But it's just, okay, they know Daddy has a bit of a weird leg. and that's about as much as they know. Yeah.
Yeah. And I mean, in their age, of course, they have so much going on.
There you go. So
they are probably.
Hopefully we'll learn a bit more later on. But that's it. So they have a lot of help. So the MS League, and I guess it's the same thing for the French MS Society, to help the people themselves, the talk groups, family members, and also children. And then also a specialized young people with MS. So that ranges from, I don't know, from 10, 12 years old until I think 30. So I'm out of the young people group now. Yeah.
A little bit.
Little bit, yeah.
But as you just mentioned, I mean, people are getting older with MS. Yeah. So are there any additional challenges living with MS when you are over, let's say, 60? Because normally the study trials are always until 55. And
that's tough, I know. And I've been thinking about that. I don't know too many people with in that age bracket, let's say, over 60. I know that the people that I did see when I went to the MS Center, there were plenty of them that basically not lived there, but were at the MS Center a lot of the time or on a daily basis, driven over to do physiotherapy, to do different things, swimming, etc., to keep on moving and being mobile. Because you cannot expect any local swimming pool, for instance, to have the abilities for you to do swimming or any things, because many people were completely wheelchair bound. So then, just swimming is not an option on your own. So these things are available, but again, depending on the center you go to or the hospital you go to, or the people you know, probably now.
Okay.
So I don't know if there's any specific things about people over 60, but I'm guessing at different centers they will tell you more and more when you're in that age group.
Yeah, but helping with physical therapy is already something, and
definitely. Yeah.
So that's good. Are there any specific initiatives or programs in Belgium that focus on raising awareness about MS? I mean, you just said your daughters don't really know what MS is. And of course, the general public probably is even worse.
It's even worse off, that's for sure. Well, you have, of course, the World MS Day, and all of the MS societies, they try to put MS on a clear picture for everybody. So what they do in Flanders, they have chocolate sales. Chocolates are quite a good thing in Belgium. Again, it's a good place why I live here now. So they sell these chocolates and to raise awareness again. Mm-hmm. And it's always a very positive thing. Obviously, during COVID was a bit tricky and difficult, but it's picking up again. So the World MS Day, weeks beforehand, they start doing these chocolate sales. The MS Society also has raising awareness, of course, either through their magazine, the publicity they make, and also for me now being an MS expert, I can be asked to do different talks for students, pharma, government, as I already mentioned. So that's another thing to raise awareness. And of course, like you do as well, you have individuals that try to raise awareness within their group of people that they know. I think those
sounds good.
Yeah.
How can individuals with MS in Belgium actively advocate for themselves and ensure that they receive appropriate care?
I think you need to be on top of your disease yourself. So don't always rely on your neurologist or healthcare team that you go to. Try to read up on things yourself. When I go 2 or 4 times a year to the hospital, I always have my lists ready. And I make lists during the year, because when you just do a list before you go, you forget all about all the things you've had before.
Absolutely.
So I just make notes throughout the year, let's say. And then I've got my list ready for when I see the doctor or whoever I see at that point. So I think that's an important one you can do actively yourself. You can use apps for these things. You can use Post-its even. It's whatever people do, but you have to do it. I think. I mean, I say I have to, but otherwise you shouldn't complain either that you forgot to ask something. Because quite often what I hear, people say, I got out of the meeting with my doctor and I had a few questions still that I prepared, but I didn't ask. So make sure that you're well prepared. Look for information yourself, but not information everywhere. So I try to avoid staying away from social media. Mm-hmm. Now, there are certain social media out there that are very good, but there's also plenty out there that don't have the information that you want to believe, or I don't know.
Exact information, or too much emotional, or
There you go. And many people, they go for information that's big, that's out there. Oh, this is the cure now. And unfortunately, it's not always the case. So you don't want to get your hopes up too high or listen to things that people said without making sure that this is correct information that's scientifically proven, etc.
Yeah, and that's a big issue. I mean, you can have pretty pictures, and then it for some people who are not that well educated on the topic of MS, it maybe sounds totally clear and structured and fine and well, but it's absolutely not. So please go to the serious resources.
And I think the serious connections, you can get them through the MS Society again. They offer you so many information in whatever language you want, basically. So it's all out there, quality information. So read it, check the website. Also talk to peers. Again, through the MS Society, we're trying to set up something like a buddy system. If you're newly diagnosed, if you can be linked to somebody else that is either the same age group or same whatever, it really helps many people to talk to people like them. And to explain how you went through all those first weeks, months, or years even with having the disease. So I think these are things that you should do if it helps.
Totally agree. What role do family members and caregivers play in supporting individuals, and what resources are available to support them? I mean, you already said there are things for the relatives with the organizations.
Yeah, definitely. So through the organizations, there's either talking groups for caretakers. There's this for the children also, talk groups, or even it's not just a talk group; it's more a playful thing, depending on the age of the child, of course. Information is out there, both digital and on paper. All these things are possible. I think that even now, if you ask the government or tell the government that you take so much time to care for a person with needs, then you can even be paid a bit for that. Because usually people do that without being paid. But yeah, some people have to take time off from work to help their husband or wife.
Yeah. Or mother, or father.
Mother, I mean, or father. There you go. Yeah.
That can be quite challenging and time consuming and emotionally not easy.
Training as well. Yeah, very, very difficult. Yeah.
What advice would you give to individuals with MS who may be feeling overwhelmed or discouraged? And how can they maintain a positive outlook? I mean, you have no issue with that, but lots of people do.
Yeah, no, for sure. Many people do. And it makes sense that people do, because you start thinking of the worst. What I did when I was, I think, about 21, 22, I picked up a book. It was called The 7-Day Mental Diet. And it's tries to make you think of positive things for 7 straight days. So if you have something negative going on, you have to restart. You have to think 7 straight days of things that that go on in your life, but always try to turn it around. So like I said, now when we start the conversation, it's raining here. First thing that comes to my mind is, okay, great, it's raining. If I were to live in Greece at the moment with all those forest fires, I'd be really happy to have so much rain. It's great for the flowers. I mean, there's so many things. I don't have to wash my car now because it is done.
It gets washed.
Yeah. So all these things. I mean, you can easily find positive things in a negative tone. So try and have a positive outlook. Live day by day. Don't think of all the horror that can happen to you. Because you don't know, maybe it will not happen to you at all. And try and do as much as you can to stay as active as possible, both in work, because I think it's a very important part of everybody's life, to keep working with colleagues and to do things that make you feel useful. Because you sit at home and you watch the rain fall and you just watch the grass grow, you're not going to be very fulfilled and content. So it's important to also make sure that you go around with people that have a similar mindset. Now, of course, if you have family members that are not as positive, you can try and turn it around. But that's also, that's how I have with my wife. She always sees the glass half empty. I see it more than half full.
Same here. I always have the discussion with my husband, and he tells, I mean, I'm always the positive one and happy. And if things happen, then I'm just for a short period a little bit sad, but then I'm happy again. And he tells me, see, and because I was not so positive, I was not sad at the end, but I'm saying, but come on, if we compare our life, I don't know, 95% happy and you are 50%, let's see what comes and
Yeah, for sure. So I think that's very important. And that's why I like to talk both to you and other people with similar mindsets. It's not 1 + 1 is 2, but 1 + 1 is 3 all of a sudden, because you both get something out of it. And to laugh about things, and also the words you use is a very important one. When I tell people, if you tell somebody, don't panic, what are they going to do? They're going to panic. Yeah. So you have to say in a positive sense, relax, take it easy. And that's, makes a huge difference. If you keep on having negative words in your vocabulary on a daily basis, you don't notice it yourself anymore. But in the psyche, it really works. Yeah. So I can keep on going about this, but I think that's very important. Yeah.
And it's good advice. Totally.
But fantastic. Also, I said live day by day is important, but also plan for the future. Also be realistic that if something were to happen, because MS is a very difficult disease and you don't know what the future will hold. So do plan for the future, but don't plan for the worst immediately, that it's going to happen next year. Yeah.
Yes.
Be realistic.
Yeah. Realistic with a positive mindset.
There you go. That's beautiful. Thank you. Yeah.
Okay, let's come to the quickfire Q&A session. Yeah. Complete the sentence. For me, multiple sclerosis is
a challenge.
Yeah. Sorry.
No, that's it. Yeah, a challenge.
Okay. Which website can you recommend for people living with MS in Belgium?
I would say both of the MS websites for the MS societies is very good. If you're English speaking, there's a great one in the UK. I can send them to you later on. I've got them in a Word file here.
Yes, I will put them in the show notes.
Yeah,
in the blog entry.
So I think again, it's in Flemish for the Flemish part, and in French for the Walloon or the French part of the country. So I think those are the first ones you want to go to.
Yeah. As an expert, what development would you like to see in the field of multiple sclerosis in the next 5 years?
Yeah, I've been hearing about this myelin recreation, let's call it. So they're doing research on that also with animals for the moment still, but it's not been very positive yet. It would be great for me to see all of a sudden all the plaques that I have when I see the MRI photos to disappear, or that they can recreate these things. I mean, that to me is the holy grail. Now, it might be 5 years a bit too soon. But there's lots of research going on. Effective therapies, they're becoming more and more effective to stop the progression. I think that would be a first. And if you have in the beginning, when you are nearly or early diagnosed, immediately go for the bazooka, the very strict treatments that stop the disease immediately. That would be wonderful, of course.
Yeah.
So those are the two things I was thinking about in the next 5 years.
Yeah. Let's see what happens. Yes, but I would like to see
because
that
as well. I mean, I think that I hear people speaking, and these are neurologists on world level neurologists that say, it's possible. I think we are not close, or we are quite close to actually getting treatment that can stop progression, and maybe even find out where it comes from.
Yeah, let's see. Yeah, the BTK inhibitors will be interesting when they out. And I, for the German podcast, I heard very often from the experts the vaccination, so that we can stop onset of disease for at least most of the people. Would be interesting. You have 2 daughters. I have a daughter, and as a lady, you are more. You have a higher chance of getting MS. So would be lovely to see that. And I think that's quite possible in the next 5 years. Would be great.
Good. Yeah, I just spoke to the neurologist about it as well, and it's exciting times.
It is. Finally, what message of hope or encouragement would you like to share with the individuals living with MS in Belgium and of course the world?
Yeah, the world as a whole, and beyond that even. Live day by day, so be happy, because life can be very short and can be very unhappy if you just look at the unhappiness in your life. So plan for the future, as I said. Look at the good things that you can still do and enjoy the things as much as you can. And also ask for help. I know it's very difficult. I don't do enough either. But it's amazing. I use a cane sometimes now. And then all of a sudden, I mean, people are so friendly and helpful. I said, no, it's okay. But it's amazing what these little things can do, because beforehand people think, oh, you're walking a little dangerously, you must be drunk, and now they say, oh no, that's something else. What's going on?
Yes,
the people are quite helpful, I must say.
They are, and they are normally happy if they can help other people.
There you go. That makes everybody happy to help somebody else.
How and where can interested people find you online, Pieter?
I think LinkedIn would be the best thing to find me online. So I'll also send you a LinkedIn link where they can find me, because I think those are the main ones. If you just type my name in Google, you'll probably find me in the different categories as well, still at my website or other things. But MS related, I think that's a good way to find me. Yeah.
Great. Pieter, thanks a lot. I hope maybe we'll see each other at ECTRIMS. Would be great. Are you joining?
It would be great. I'm trying to get somebody to pay for my flight and going over there still. But yes. I'm looking forward to going and meeting you maybe in Milan. Yeah.
Yes, would be lovely. Thanks a lot. Bye-bye to Belgium.
Okay, bye-bye.
I hope you enjoyed the interview, learned something new, and got inspired by Pieter to look on the bright side, even when having MS. Because it is always better if you try to concentrate on the positive things that are still existing in your life. By the way, next time I'm going to talk about fatigue in all its aspects, because there are many things that contribute to the fatigue, which is bad on the one hand, but on the other hand, if you look at the positive side, there are many options where you can improve your fatigue, meaning lowering it, of course, by improving your sleep quality, looking at other symptoms that can increase the fatigue and so on. So please tune in again and hear you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. Hear you next time.